Okay, this is MDC3 Exam 1 Concept Guide. Describe the examinations used to detect breast disorders, including breast awareness and self-examination, ultrasonography, mammography, and MRI. So mammography, you get an annual at age 45 and continue if you have a life expectancy of 10 years. Clinical breast examination is performed by a provider or nurse practitioner every 3 years for ages 20 to 30, and an annual exam if you're asymptomatic at least 40 years of age. And self-breast exam is performed monthly. Why is positioning important when performing a self-breast exam? You do this after menses. You raise the arms to expose lymph nodes and widen breast area while lying down. What if a woman is high risk? Okay, so these is for the age greater than 65. It's early or late menses, hormone replacement, and dense breast tissue. Discuss risk factors for developing breast cancer. Dense breast tissue. Which method is the only definitive way to detect breast cancer? A biopsy. How is it classified? DCIS or ductal, this is early, non-invasive. Or lobular, which is LCIS, and this is within the lobe. What patient education should you discuss? Post-surgical care, lymphedema, improvement of body image, and coping. Okay, what are leiomyomas? Fibroids in the uterus. How are they classified? Intramural, which is uterine wall, submucosal, which is protrude into the uterine cavity, and subserosal, which is outer surface of the wall. What signs and symptoms may a client report? Heavy vaginal bleeding, dyspareunia, which is painful intercourse, and a lot of clots. What are some priority questions you should ask? How many tampons or pads are used per day, and the menses duration? What labs do you anticipate may be ordered? H&H, CBC, transvaginal ultrasound, and a pregnancy test. What is the most common gynecological malignancy? This is endometrial cancer, which is adenocarcinoma is the most common. Stage 1 is confined to the endometrium. Stage 2 involves the cervix. Stage 3 reaches the vagina and lymph nodes. Stage 4, it spreads to bowel and bladder. What are the signs and symptoms? Which one is the most reported? Abnormal uterine bleeding, postmenopausal patients, that's for postmenopausal patients. Tampons, pads, how many tampons and pads are used per day? Which diagnostic tests are considered the gold standard? This is CBC for anemia, CA125, which is cancer tumor markers, alpha fetoprotein, HCG, transvaginal ultrasound, and endometrial biopsy. Discuss non-surgical versus surgical management and how should you as the nurse approach the client when helping to adapt to changes associated with treatments. Non-surgical is radiation, brachytherapy, which is 10 to 20 minute sessions and must be isolated, EBRT, and chemotherapy. Surgical is total hysterectomy. What are some important patient teaching topics to review total hysterectomy? Never mind. Ovarian cancer, if it comes back, it's treatable, but not curable. Most cases of cervical cancer are caused by which types of HPV? 16 and 18. Are there any preventative measures that can be taken? HPV vaccine, PAP, and HPV testing. Signs and symptoms is painless vaginal bleeding, friable surface, painful intercourse, hematochezia. How is cervical cancer diagnosed? Pap smear, colposcopy, cervical biopsy, endocervical curettage. What are the client's treatment options? Non-surgical is radiation. Surgical is LEEP, which is loop excisional procedure, or cone biopsy, laser, or cryo. What teaching should be provided to a client and family regarding radiation therapies? Do not get up with the implant in place. Discuss the most common causes of non-sexually transmitted infections. Why do they occur? Disturbance of balance of hormones and flora in the vagina and vulva. What would you include in the treatment plan for prevention? Focus on the causative agent, wipe front to back, and no sprays, no soaps. Define pelvic inflammatory disease, or PID. Organism from lower genital tract migrate from endocervix up the uterine cavity into fallopian tube, leading cause of infertility. What causes it? Endometriosis, salpingitis, ophiritis, tubal or tubo-ovarian abscess. What are signs and symptoms and complications that can arise? Lower abdomen and pelvic pain, most frequent symptom. Patient may appear hunched over in guarded position, vaginal bleeding, dysuria, vaginal discharge, malaise, fever, and chills. How is it treated? Does it require hospitalization? Diagnostics is culture and discharge, CBC, HCG for pregnancy. Treatment is antibiotics for 14 days, possible hospitalization depending on severity, semi-Fowler position to promote drainage. What happens with toxic shock syndrome? You left a tampon, diaphragm, or sponge in the vagina for too long. List some of the most common signs and symptoms. Fever, diffuse macular rash, myalgia, hypotension. How can it be prevented? Removal from infection source, restoring fluid and electrolyte balance, and drug therapy. Surgery, patient teaching, infection and bleeding. Discuss benign prostatic hyperplasia, BPH, non-cancerous overgrowth of the prostate, most common in African American men ages 55 and over. What common signs and symptoms may a patient report? Nocturnia, dribbling urine, weak stream, straining to initiate stream, and hematuria. List labs that may be ordered and why. UA, which is a microscopic blood and urine, and UC is to rule out infection. CBC is if the RBCs decrease, and BUN is for kidney function. Serum acid phosphatase is determine metastasis, and a biopsy is for cancer detection. Transrectal ultrasound, or TRUS, is looking at the size of the prostate. Are there any drugs that a client should avoid with BPH, and why? Anticholinergics, because it will dry up. Meds for BPH. 5-alpha reductase inhibitors shrinks the prostate size, and finasteride relaxes the smooth muscle. Use both in combination. What is a TURP? Transurethral resection of the prostate. It's the gold standard. What are some priority nursing interventions post-op of TURP? Bleeding in the first 24 hours, education on catheter care and infection, pain management. Post-op urinary catheter color is pinkish. If ketchup, it could indicate clots and notify the provider. Bright red drainage from TURP in 24 hours, the initial action, increased rate of bladder irrigation. Discuss prostate cancer. It's slow growing. Why? What is the leading risk factor? Who is most at risk? Advanced age, 65 and over, first degree relative with disease, which is father, brother, or son, and African American men. No early versus late and advanced manifestations. Elimination issues, pain, weight loss indicates metastasis, and changes in sexuality, which is decreased libido. Pain in pelvis, hips, spine, ribs indicates metastasis and blood and lymph. No screening procedures and recommendations like PSA and EPCA-2. Okay, so PSA is prostate-specific antigen. You do this before a digital rectal exam. EPCA-2 is an early prostate cancer antigen. PSA labs tests are drawn before the DRE. And NP will massage the prostate to obtain fluid sample for possible prostatitis after performing a DRE on a client with BPH. Which labs indicate advanced prostate cancer? Serum acid phosphatase. Which is the most common procedure used for cure? Prostatectomy. That's the removal of the prostate. When does testicular cancer often occur in men? Ages 20 to 35. What are the clinical manifestations? Painless lump in the testicles. What should a client do if concerned about future fertility? Sperm banking. Discuss and explain patient education for TSE. Testicular self-exam. This is palpate the testy. How is it performed? Monthly after a warm shower. What are the differences and causes of organic and psychogenic ED? Organic is age, diabetes, BPH, gradual decrease of firmness, and frequency of erection. Psychogenic is sudden onset and high stress. What types of treatment options are available? Sildenafil, you take 15 to 60 minutes before, or taldilafil has no plan, you can take it anytime, lifestyle modifications, and a vacuum erection device. Which STIs are notifiable to local health authorities in every state? Chlamydia, gonorrhea, syphilis, chancroid, and HIV. What is the difference between HSV1 and HSV2? How is it treated, and what are four important teaching points? HSV1 is mouth, it's a cold sore. HSV2 is genital. The incubation is 2 to 20 days. It's asymptomatic. IgG says if the IgG levels are high, you had it in the past. Or if the IgM levels are high, you have a new infection. Immunoglobulin, acyclovir, and valacyclovir. Know the 4 stages of syphilis and what manifestations present during each phase. So the primary stage is it's just started. There's a chancre store on the genitals or mucous membranes. Secondary is flu-like symptoms, rash on palms, hands, and sole of feet. Latent is no symptoms with elevated levels. Tertiary is neurological cardiac issues, which is a systemic infection. VDRL is venereal disease research lab. RPR is rapid plasma reagent. What is the preferred treatment? Benzathine penicillin G, IM, 30-minute observation, follow-up in 6, 12, and 24 months. Which are most common types of HPV and cause condylomata? 6 and 11. How is it treated? Cryotherapy, excision, and electrocautery. List signs and symptoms of chlamydial infections for females and males. It's asymptomatic. What is the recommendation frequency for screening? Annual, during a pap smear. Is it the same for men? No. What is the treatment of choice? Azithromycin and doxycycline for 7 days. What instruction should the client be made aware of post-treatment? Oh, never mind. How soon does symptoms of gonorrhea appear? It's asymptomatic and 1 week after sexual contact with infected partner. List the clinical manifestations of both men and women. The male is epididymitis. What is the most common type of testing for initial diagnosis? Testing for HIV and chlamydia for initial diagnosis. Should clients undergo any testing? Testing for all STDs. What is the recommended treatment? Why is this combination of drug therapy necessary? Is a test of cure needed? Ceftriaxone and azithromycin combined. 7 days of abstinence. If allergic to azithromycin, give levofloxacin. What is pelvic inflammatory disease? Organisms move from the endocervix upward through the uterine cavity into the fallopian tubes. List the most frequent signs and symptoms: dull pain, irregular bleeding, discharge, painful urination, and friable cervix. How is it treated? Does it require hospitalization? Oral antibiotics, and if OB patient, then hospitalization is needed. Types of urinary incontinence: stress, urge, overflow, and functional. What patient and family education would you provide? Nutritional therapy, lots of protein. Drug therapy, like antispasmodics. devices, and electrical stimulation. What is the most common factor associated with new onset of UTIs? Catheters within the first 48 hours and E. coli. What is the treatment? Fluids and comfort measures. List some ways of prevention. Sterile technique, keep the area clean, and fluid intake. Know the difference between urolithiasis and nephrolithiasis. Urolithiasis is in the urinary tract. Nephrolithiasis is in the kidneys. List the signs and symptoms of stones. Painful, they're going to need morphine. What is the most important factor for whether a stone will pass on its own? The size. What are some options if it can? Lithotripsy, this breaks up the stone. Know the difference between acute and chronic pyelonephritis. E. coli kidney infection. Chronic is structural, acute has not been treated. It's most common between 20 and 30 years old. List the signs and symptoms and causes for both. Flank pain, C-reactive protein, this is for inflammation, and ESR, which is sedimentation rate. How does acute glomerulonephritis develop? Glomerulus is not working, this is fluid balance not filtering. Chronic glomerulonephritis, it develops over years to decades. Mild proteinuria, hypertension, hematuria, and edema. What signs and symptoms would the client show? Lung crackles, this is fluid overload, and uremic symptoms. What labels do you expect to be abnormal? 24-hour urine collection, BUN, GFR, and ABGs. What is the main feature of nephrotic syndrome? Glomerular permeability increases. Knowing this, what do you as the nurse want to ensure the patient has enough of? Protein. What is polycystic kidney disease? Genetic kidney disease. What are the clinical manifestations? Hypertension, abdominal fullness, cyst bleeding, hematuria, and infections. What is the primary method used for diagnosis? Ultrasound, MRI, and urinalysis. What are your primary nursing interventions? Manage pain, blood pressure, prevent constipation, and fluids. What is the most important factor to teach a client with diabetic neuropathy, uncontrolled diabetes? Discuss the most common treatment for renal cell carcinoma, weight loss, urinary changes, and fever. What kidney function declines gradually? It is diagnosed as what? Acute. How about if kidney function declines sudden? It's chronic. List the causes of acute kidney injury: dehydration, prolonged mechanical ventilation, and sepsis. Why is hydration so important in a KI? You need to drink 2 to 3 liters of fluids. Fluid and electrolytes, cardiac, hemolytic, immunity, GI, and cognitive. Patient going to hemodialysis, do not give heart medications. Following dialysis, the nurse should anticipate the temperature to increase. Okay, here's some questions. The nurse is counseling a client who has tested positive for syphilis. What teaching will the nurse provide regarding the client's partner? Please share accurate information about your partner so prophylactic, expedited care can be initiated. What teaching will the nurse provide to a client newly diagnosed with gonorrhea? You are contagious even if you have no outward symptoms. The nurse is providing expedited partner treatment, or EPT, to a client who is newly diagnosed with chlamydia. What is the appropriate nursing action? Give the drug and directions to the client for the partner. The nurse is discussing the prevention of sexually transmitted infections with a group of young adults. What information does the nurse include? The risk of STIs increases with the number of sexual partners. The nurse is counseling a client and the client's sexual partner on safer sex practices. Which client comment indicates a need for further education? Condoms are for vaginal and anal sex, but not for oral sex. The nurse is collecting a client history prior to gynecologic examination. Which comment by the nurse needs to be reworded to show respect for the client's personal values and beliefs? Have you participated in homosexual relationships? The nurse is teaching a group of men about sexually transmitted infections. What sign does the nurse identify that may appear in the primary stage of syphilis? Painless chancre. The nurse is evaluating a client's response to antibiotic treatment for pelvic inflammatory disease. Which assessment finding indicates that the treatment is effective? Lessened pelvic tenderness. The nurse is teaching a female client about antibiotic treatment for pelvic inflammatory disease. Which client statement indicates that teaching has been effective? These antibiotics must be taken for 14 days. The nurse is assessing a male client with chlamydia trachomatis. What assessment finding does the nurse anticipate? Dysuria. The nurse is creating a plan of care for a client with newly diagnosed pelvic inflammatory disease. Which problem does the nurse identify as the client's highest priority? Bacterial infection. The nurse is administering benzathine penicillin G intramuscularly to a client with primary syphilis. What precaution does the nurse implement when the client reports never having received penicillin before? Keep the client in the clinic for 30 minutes after drug administration. The nurse is teaching a 19-year-old female with genital warts. Which client statement requires further education from the nurse? Wart remover treatment from the drugstore will help me get rid of them. The nurse is teaching a group of young women about screening for chlamydia. Which client statement demonstrates that nursing teaching has been effective? If I am a 40-year-old woman with a new partner, I need to be screened again. A client with a newly diagnosed pelvic inflammatory disease is prescribed an antibiotics as an outpatient. What teaching does the nurse provide about the treatment regime? Rest in a semi-Fowler position to help with the infection and pain. The nurse is planning care for a client who has a sexually transmitted infection. Which intervention addresses the client's psychosocial needs? Allow the client to express fears and anxieties, approach the client with a non-judgmental attitude, and refer the client to the appropriate support groups. Which sexually transmitted infections does the nurse identify that can result in a vaginal infection? Chlamydia, gonorrhea, and syphilis. Which intervention does the nurse suggest for a sexually active client to reduce chances of getting an STI? Abstinence, latex condoms, mutual monogamy, and polyurethane condoms. A client with testicular cancer is worried about sterility and the ability to conceive children later. To which resource does the nurse refer to the client before surgery takes place? A sperm bank facility. The nurse is caring for 4 clients. With which client does the nurse discuss prostate cancer screening? A 57-year-old who has fathered 4 children. The nurse is educating a group of young men about testicular self-examination. Which statement by a member of the group indicates teaching has been effective? I will look and feel for any lumps or changes to my testes. Which assessment finding is the priority for the nurse to report to the healthcare provider? Painless testicular lump. A client reports taking a supplement that his partner recommended for benign prostate hyperplasia. Which supplement does the nurse anticipate the client is taking? Saw palmetto. What will the nurse include in teaching to assist the client with BPH to address incontinence? Practice Kegel exercises to improve muscle control. Which client will the nurse prioritize when teaching about prostate cancer screening? A 50-year-old African American. A young adult with testicular cancer is admitted for unilateral orchiectomy and retroperitoneal lymph node dissection. Which task will the nurse delegate to assistive personnel? Encourage the client to cough and deep breathe after surgery. The emergency nurse is assigned to care for 4 clients. Which client does this nurse see first? Adolescent with an erection for 10 or 11 hours who is reporting of severe pain. A client with erectile dysfunction has been prescribed PDE5 inhibitor. Which client statement demonstrates that nursing teaching about this medication has been effective? I have to be sure to be careful when I sit up or stand up. A client with BPH is being discharged with a prescription for prazosin. Which teaching will the nurse include? Avoid drugs used to treat erection problems, be careful when changing positions, and keep all appointments for follow-up lab testing. A client has undergone transurethral resection of the prostate, or TURP. Which intervention does the nurse incorporate in the postoperative plan of care? Administer antispasmodic medications and assist to mobilize as soon as permitted. After returning from transurethral resection of the prostate, the client's urine in the continuous bladder irrigation is a burgundy color. Which client needs does a nurse anticipate will be prescribed after the surgeon sees the client? Antispasmodic drugs and monitoring for anemia. A client has recently had a vaginoplasty and has noticed stool coming from her vagina. The telehealth nurse advises her to immediately go to the emergency room department. What is the nurse's concern? Vaginal rectal fistula. A client is beginning transdermal estrogen therapy, or Clemera. Which client statement requires additional health teaching by the nurse? I will need to change out the patch once a month. How will the nurse refer to a client who self-identifies as the opposite gender? A transgender individual. From what age may a child begin to feel a sense of maleness or femaleness? 2 years. A transgender female client reports difficulty sleeping, anxiety, and hypervigilance. She states, I just can't stop thinking about what they did to me last New Year's Eve. They slashed my tires. What is the appropriate nursing action? Consult with the healthcare provider for referral to a counselor. The nurse is orienting a newly hired assistive personnel to the clinic. One of the clients has self-identified as transgender. The AP states, I don't want to say the wrong thing. What do I call the person? What is the appropriate nursing response? Ask how the client would like to be addressed. The nurse uses the wrong pronoun when addressing a transgender client while taking the admitted history. What is the appropriate nursing action? Self-correct and continue with admitting history. The nurse is providing education for a client who is experiencing gender dysphoria. What client statement reflects that further nursing teaching is needed? I plan to buy my hormones on the internet. A 22-year-old client wants to discuss options for treatment for a transgender dysphoria. He states, I'm confused and I need to talk to somebody, but I don't know what to do or who to talk to. I don't want my parents to know. Can you help me? What is the nurse's priority response? What you say here will be confidential. A client who has recently been prescribed finasteride reports dizziness, cold sweats, and chills. What will the nurse tell this client? These are common effects that usually diminish over time. A female-to-male client wishes to retain the option of having biological children after transitioning. What available option does the nurse suggest to the client? oocyte freezing that occur prior to hormone therapy or gender reassignment surgery. The nurse discussed gender reassignment surgery with a male-to-female client during her first visit to the office. Which client statement indicates a need for more education? The surgeon who performed my appendectomy can do my surgery. For the 12 months prior to surgery, what is one of the requirements for a client requesting a vaginoplasty or phalloplasty? Continuously living in the role of a desired gender identity. A male to female transgender client wishes to discuss breast augmentation surgery. What client statement indicates the need for further education by the nurse? Fat injections can be used instead of implants for a more natural look. A female to male client is beginning testosterone therapy. What physical changes does a nurse tell the client to anticipate? Increased muscle mass, deepening voice, fat redistribution, and menstruation cessation. A female to male client is beginning testosterone therapy. What physical change does a nurse tell the client to anticipate? Oh, I already did that one. A male to female client is beginning estrogen therapy. Which data obtained from the client's history are of concern for the nurse? But a BMI of 32, smokes 1 pack a day, and takes medication for blood pressure control. The nurse is facilitating a discussion at an LGBTQ gathering at a college. One student asks what kind of surgeries are available for someone who wants to transition from female to male. What options will the nurse teach? Vaginectomy, metidioplasty, and scrotoplasty. A nurse is caring for a woman who had a hysteroscopic surgery for uterine leiomyomas. On initial assessment, the nurse notes the following: pulse 114, respiration 20, Crockles and bilateral lung bases. What action by the nurse takes priority? Call the rapid response team. The nurse is educating a client on the prevention of TSS. Which statement by the client indicates a lack of understanding? I need to change my tampon every 8 hours during the day. A client is admitted to the emergency department with toxic shock syndrome. Which action by the nurse is most important? Remove the tampon as the source of infection. The nurse is caring for a post-operative client following an anterior cholecystectomy. What action can be delegated to the AP? Drawing a shallow hot bath for comfort measures. A nurse receives handoff report on 4 post-operative clients who each had total hysterectomies. Which client would the nurse assess first upon initial rounding? Vaginal hysterectomy, 2 separated perineal pads in 2 hours. 2 saturated perineal pads in 2 hours. A client has undergone a vaginal hysterectomy with a bilateral salpingo oophorectomy. She is concerned about a loss of libido. What intervention by the nurse would be best? Teach that estrogen cream inserted vaginally may help. A client has recently been diagnosed with type 2 endometrial cancer and will be treated with a brachytherapy. What statement by the client indicates a need for further education on this treatment? I have to be alone in the room during treatment so I don't expose others. The outpatient clinic nurse has assessed a woman who reports a month-long history of feeling full, urinary frequency, and bloating. What action by the nurse is best? Teach the woman about CA-125 test. The nurse has educated a community group of risk factors for ovarian cancer. Which statement by the participant shows the need for reviewing the information? This is a disease of young women. A nurse has taken an informed consent to a woman who is having a transvaginal repair of a prolapsed uterus. What client statement indicates the need for more information? The mesh they use may become infected. A 25-year-old woman is concerned about contracting HPV. What information by the nurse is most appropriate? We can provide HPV testing along with your pap smear. A 28-year-old client is diagnosed with uterine leiomyoma and has experienced severe symptoms. Which actions by the nurse are the most appropriate at this time? Teach non-pharmacologic comfort measures, relieve anxiety by relaxation techniques and education, and review complete blood count for possible iron deficiency anemia. The nurse is giving discharge instructions to a client who had a total abdominal hysterectomy with a vaginal repair. Which statements by the client indicate a need for further teaching? I should not have any problems driving to see my mother who lives 3 hours away. Now that I have time off from work, I can return my exercise routine next week. A nurse is taking the history of a 24-year-old client diagnosed with cervical cancer. What possible risk factors would the nurse assess? Smoking, multiple births, and infection of HPV. A client is scheduled to start external beam radiation therapy, EBRT, for her endometrial cancer. Which teaching by the nurse is accurate? Your skin needs to be inspected daily for any breakdown. It is not wise to stay out in the sun for long periods of time. The perineal area may become damaged with radiation, and you will not be radioactive or pose any danger to anyone else. The nurse is teaching a client who is undergoing brachytherapy about what to immediately report to her primary healthcare provider. Which signs and symptoms will be included in this teaching? Abdominal pain, visible blood in the urine, and heavy vaginal bleeding. A client has recurrent vulvovaginitis. Which statements by the client indicates the need for further teaching? I can take a long hot bath to relieve itching. I need to take all of my antibiotics as prescribed. I should use antibacterial soap to clean the area. The nurse is doing some care teaching for a client who has undergone cryotherapy. Which statements by the client indicate a correct understanding for the instructions? I should not use tampons, douche, or have sexual activity. I should shower rather than take a hot tub bath. There should be little or no discomfort.